Greetings of the season. I am Dr. Vijay Varat. I am practicing allergist and clinical immunologist last 27 years in Pune. As the allergy has been a very big problem into the community. Children, it's a number one chronic disease. In adults, every third person is suffering with some or the other allergies. So as a practitioners, we all are managing symptomatically. Even patients only decide what treatment they want. So many people go to homeopathic, Ayurvedic, even homemade therapies. And symptomatically, when the patient is in mild to moderate symptoms, they get controlled. And then underlying inflammation, which continues, in spite of patient's perspective, he is better. And the newer sensitivity is gone increasing. And later on, these patients have a very severe allergy symptoms. It may be the severe food allergies, drug allergies, or asthma, chronic respiratory diseases, sinusitis, obstructive sleep apnea, ocular allergies. 30% of the ear problems, deafness can be because of the allergic rhinitis. So the allergic rhinitis is the central part, and adjoining all these comorbidities, later on we'll have a very severe symptoms. So as a practitioners, how is our role? It's just not only to manage symptomatically, but our role is to identify the problem and to treat the root cause. So, like a diabetes, how everybody has a uniformity and the patient is guided properly about that. The same way, when we want to prevent this allergic progress, which is called an allergic march. So, how, as a practitioners in our practice also, we can improve this awareness amongst the community about this progression of the disease and the complications later on. So, even you can improve your practice. You start picking up these patients and counsel them, and then they will definitely will adhere to you, and you can yourself increase these practice. So, what is this allergic march? A typical allergic march is from skin, like lot of people, children have atopic dermatitis or eczema. Then many of the children have a gastrointestinal symptoms like GRD, like vomiting, then stomach problems, colics and all. Even 40% GRD patients can have food allergies. And then amongst that, again, the food intolerance also can be in many people. And later on, these patients go into seasonal allergic rhinitis. Allergic conjunctivitis is a very big problem now during this summer. We are seeing a lot of upsurge of allergic conjunctivitis and urticaria. And later on, again, many of the children in the adolescent period go into David and nasal septum, sinusitis, tonsillitis, throat problems or something, and leading to the airway problems also, asthma, chronic respiratory diseases like COPD. And as a practitioners, our role is not only symptomatically, but long-term wise also, this progress, how can we delay, we can halt, uh, I will say possible cure also can be achieved with the poor management. So we try and we all know like atopic dermatitis, rhinitis, and asthma. So now that even the rhinitis term has changed, it is a rhinoconjunctivitis. GINA 2023 guidelines or the European Academy 2017 guidelines, where I was also one of the review faculty author for that guidelines. And that rhinoconjunctivitis because 95% of these rhinitis children have a ocular allergy, which is underestimated and underdiagnosed, and oral. So as a practitioners, there are different type of prevention, how we can prevent these complications. Primary prevention is the development of the atopic disease, like allergic immune responses in healthy children without any evidence of abnormal allergic immune responses. And how we can prevent it, it is like an infantile diet also, as well as the children which are exposed to the cow dung or farm dust naturally, they also can have. Secondary prevention of the development of new atopic disease or new abnormal allergic immune responses. Like what does it mean? Like eczema, 70 to 80% of the children overcome, but later on go into rhinitis, conjunctivitis or something. Childhood asthma also 85% of the children overcome the asthma, but later on go into David and nasal septum, sinusitis, severe ocular allergy, eczemas, or other complications. So now that atopic march has also changed. Sometimes the patient can present in a gastrointestinal symptom, some patients present with the rhinitis, Later on, they can have eczema. So adolescent eczema and adult eczema has also leaked. Then tertiary prevention, prevention of the progression of the severity and exacerbations of the already established allergic disease. So we want to prevent this severe asthma, obstructive sleep apnea, which itself leads to the paralysis or cardiac problems or even the cardiac strokes or other complications. So, or hypertension. Around 70% of the people, because of this obstructive sleep apnea, can have hypertension. So, we want to prevent these complications. Is it possible? Yes, there are studies done, and they have said that if the children, even the mothers, if they are supplemented with probiotics, vitamin D, and all, they have been a very good response. Then again, persistence of the oral tolerance to peanut. They showed that in early infancy, if the children are exposed to these peanuts, milk, and all, they will have a tolerance to that. And in Indian scenario, we have seen that our children have been given these things from the beginning. So that's why we never had such a severe food allergies. So look at the allergic march is important. Feeding for 4 to 6 months the peanut powder or diluted peanut butter cuts the risk of peanut allergy by 80%. Feeding young babies common food allergens teaches their immune system to tolerate the food. Even in the US, the solid foods at an early age to prevent the food allergy. There is increasing evidence that early food introduction may help lower the chance of food allergy in later life. Avoiding the tobacco smoke, pollution, certain viruses, RSV may help prevent asthma. But there is another theory, like hygiene theory. If the children are exposed to the natural infections in the early, like in house, like previously there were different children in the same family. Now there is a nuclear family. That's why this hygiene theory, now the allergy has increased. So the natural infections can prevent the allergies. Even recently there is a data which has shown that the children which are going to the nurseries and having a infections, they have less allergies later on. So breastfeeding is very important for the lung growth and reduces respiratory infections. Even it can reduce the asthma and severe allergy. So consuming milk in the first trimester reduce the odds of the third child getting allergic rhinitis and asthma. Eating wheat in the second trimester reduce the risk of the child developing atopic dermatitis or form of eczema. Dust mite allergy is a predictor of asthma and atopic dermatitis in children. Eliminating dust mites from your home may prevent the dust mite allergy, which then may help prevent asthma or atopic dermatitis. The use of hydrolyzed formulas for atopic prevention in high risk children is recommended in some European countries. So look at the allergic march. Even a simple technology like improving the barrier of the skin, because nowadays it has been found that the skin receptor sensitivity, dendritic cells, initially they sensitize the body, and later on, as the child consumes the foods, and later on, then pollen sensitivities and dust mite sensitivity increase. So, a good research-based, evidence-based moisturization of the skin, the soaps with a normal 5.5 pH are very helpful. So, routine skincare also can reduce the, and even the mothers with the supplemented with probiotics, because last 4 years when working with the World Allergy Organization, severe prevention of atopic dermatitis or food allergies, we found that there are some studies where it has shown that the mothers supplement with the probiotics or the child after birth, if there is a strong family history and all, if the children are given a specific probiotics, they also can prevent that. Even zinc supplementation, vitamin D supplementations also can help to. And then even there are very good foods like healthy food, organic vegetables and all in a large amount can definitely help for all this prevention of complications. And that's why even uh, integrated or holistic approach we can say, and it can really help. Then active exercises, sedentary lifestyle, the proper sleep is very important. The sedentary lifestyle should be avoided, like pollen, mold, dust mites, air pollution, tobacco, and all, depending on the trigger. Like uh, in Pune, the study was done. Like children which are traveling in the rickshaws, lower level, they are more exposed to this vehicular exhaust and all. Even the strong odors like agarbattis or uh, these kaso chap and all, they have a lot of problems. So I ask the people to avoid from them. Maintain a healthy diet. Obesity again triggers the inflammation. And stress also should be reduced. Benefit of breastfeeding already we all know. And can any other things like latest data? Suppose somebody is already having a moderate allergy and we want to prevent the complications. Then allergen desensitization, which is practiced since last 130 years in the world, can be definitely useful against the dust mites, pollens, or insects and all. And it can definitely prevent the severe anaphylaxis and improve the quality of life of the people. If you see early onset of management of atopic dermatitis, then environmental factors, parental atopy before the pregnancy, and epidermal barrier improvement, inflammation overall into the body, if it is managed, that we call it as a Th2 targeted systemic therapy, and symbiotics and all, and proper anti-inflammatory, safe antihistamines, then proper standardized allergy test, and some patients, whenever they require desensitization, definitely prevent thus complications. Allergen immunotherapy has a very good means of primary prevention. Administration of an allergen, usually over several years, to induce an immune response that promotes the tolerance. Several years means 1.5 to 3 to 4 years. Maximum patients within 3 to 4 years, we can stop it. Treatment option for many allergic diseases, sinusitis, rhinitis, food allergies, rhinoconjunctivitis, asthma, if they are not controlled with the standard therapies, then immunotherapy. It can reduce the allergic symptoms and the need for medications and as only treatment that can change the course of the allergic disease, like a disease modifying therapy. Even now, there are some studies which have shown that if there is a strong family history, parent has a hidden signs of significant allergy. If the symptoms are mild also, and there are significant dust mite or pollen sensitivities, to desensitize early so that it will definitely prevent the asthma and other complications. Immunotherapy shows a promise as a secondary prevention strategy, and it can be used in a selective proper patients. Allergen-specific immunotherapy targets the underlying pathophysiology and alters the natural history of allergic rhinitis, offers real-world benefits of long-lasting effect after the treatment cessation also. Even it is more helpful in the pediatric patients because there is a less sensitivities. As the adult will be there, he will have multiple sensitivities. Then it becomes slightly time-consuming process and the response, whatever we expect, may not be achieved. Evidence of AIT preventing progression of allergic rhinitis to asthma. Immunotherapy faces several challenges: worldwide standardization, occasional severe side effects, low patient adherence, high cost over long periods. But I will say when I'm practicing the last 27 years, looking at the complications of the disease and progression, the cost is less. Hardly for the dust mites, around 9,500 to 12,000 is the cost, or pollens also. So long term wise, these patients will go into the other complications and they will spend more money on that. Even each and every house, there are nebulizers, inhalers, and these patients lifelong they have to take a treatment. And again, going into COPD with pneumonias and other complications, cardiac problems and all. Rather than that, this is the best option. 2 years of treatment was effective, but not long enough to lead to the long-term tolerance. And that Th2 cell response paralleled the transient clinical outcomes, while Ig blocking antibody persisted constantly. You can see this picture how these are the inflammatory cells, mast cells, eosinophils, and all, and Th2 inflammation. And successful specific immunotherapy improves the tolerance to allergens, decreases immediate and late phase reactions, prevents new sensitization tolerance to allergens, prevents progression of allergic rhinitis to asthma late phase reactions, decreases the Th2 cytokines like interleukins, interl, IL-3, IL-4, IL-5, and all. In 20 patients in Pune, with the National Cell Sample Laboratory, we did a study and where we found the interleukins were increased in these patients. And when the allergen immunotherapy is given, they are also reduced. And induction of IgG1, IgG4, IgA antibodies, so suppression of the Ig. So there are even molecular biology has shown the benefits of that. And functional T-regulatory cells induce increased IL-10 and TGF beta factors. So these are the controlling the inflammation into the body. These are given a subcutaneous shots, sublingual or oral tablet forms. In India, most of the people are practicing in sublingual forms. That has been also consistently very helpful to the people. Subcutaneous immunotherapy, the patient has to take immunotherapy into the hospital setup. to be kept under observation for 2 to 3 hours. That's the only. Now, even the acaroid therapies are modified, purified one are available. I am doing a clinical trial in Sayadri Hospital on that, above 5 years children also. That will be again changing the future. More standardization will be there, and multiple players within 2 to 3 years will be coming in India. And then again, more competitive, lower cost also can be achieved. Recombinant B cell epitope based grass pollen vaccines, then safe, well tolerated. Even the tree pollens, the insects desensitization, dust mite desensitization, they really help a lot in these patients. And in USA and all, the more studies have been done. So there are different type of schedules. So it can be customized according to the patient sensitivity, age, and all. And we can increase slowly the concentration, building to that level where after the exposure to those allergens also, patients don't show the hypersensitivity or reactions. So, as I mentioned, these are sublingual, subcutaneous, and oral forms. And possible mechanisms, as we talked about that, the altered T helper T cell cytokine balance from Th2 to Th1 is very important. And T cell energy, B cell suppression, increase regulatory T cell functions. Biomarkers, there are definitely nowadays a lot of studies are happening. There are different, like the IgG4 antibody formation also can be measured. Still in India, it is not available, but it will be within. And IL-10 gene expression levels in whole blood may be predictive biomarker in patients accepting sublingual immunotherapy. So in future, we will have those uh, basically the biomarkers also we can. And if you see the immunological response to immunotherapy and organ response, reduces the tissue inflammation in all these nose, conjunctiva and all. Humoral response also, cellular response and other immunomodulating changes. So definitely has a long-term benefits. Symptomatic treatment, the safer antihistamine should be preferred, like its second or third generation, localized nasal sprays or inhaled corticosteroids or localized depending on the atopic dermatitis. The nowadays even newer molecules like crisaborol, even healing creams have been there, barrier improving lotions, moisturizers, soaps, bathing gels, and if any acute infected eczema and all, short-term steroids applications can be not for the longer period. Then again, uh, there are very good now localized immunomodulator medicines in the eye, also on the skin, and definitely for the asthma and rhinitis, inhaled nasal or the nasal spray corticosteroids are very helpful. Targeted therapy. This is a very good feature nowadays to prevent the allergic march because it has been found as the inflammation is controlled as early as possible. Overall mast cell hyperactivity goes down, and there are less chances of progressing to the severe allergy complications. So, in targeted therapies, there are biologics now, monoclonal antibodies, omalizumab, mepolizumab, dupilumab, benralizumab, itikimab, tezepelumab. Tezepelumab is the anti-TSLP, thymostrobal lipoprotein, blocking the pathways so that the patient will not have a multiple involvement of the other body parts. So these targeted therapies like omalizumab is against anti-Ig, then dupilumab is against IL-4 or IL-13, then other molecules like benralizumab is on IL-5R receptors, mepolizumab in against the IL-5. So these type of molecules are very well, they are covered under the insurance also, and they will have a, like a surgical style. And the use should be there in a patients where they require a oral or parenteral steroid repeatedly, where the quality of life is very poor, and they want to enjoy the life and reduce the inflammation and the symptoms also faster. They are very good. So these are different references how, as a practitioners, we can prevent the complications. 2013 World Allergy Organization had a meeting Hyderabad, and the standard all American Academy and other organization, European and all, we are doing a lot of research on that. Last 4 years working with the World Allergy Organization, Allergy Prevention Committee, myself and Dr. Ushali Varat, she is practicing in ocular allergy. We both were there and we studied a lot of 3,200 clinical practice guidelines. And it has been found here worldwide, these allergy prevention programs are used. Even recently, 4 days back, there was 450 chest physicians conference in Mumbai from the Harvard Medical. faculties and the allergist, Dr. Gilele. So what's this? He said that they are thinking about how we can early age we can pick up these patients and we can prevent the patients going into chronic respiratory disease, COPD, and all, or severe asthma leading to other complications. So coming together, all of us can definitely help the population community. And as like a diabetes, blood pressure, and all, we should also all think seriously about the allergy. Once allergy is always allergy till we don't manage it properly. And our role should not be just symptomatic relief, but our role should be to stop this allergic march in spite of the symptom control, but to stop the prevent the newer sensitivity pattern and the minimal persistent inflammation and complications in the future. Thank you. Thank you a lot.